Thank you. Good afternoon, everyone. You're all really welcome to today's HSE webinar on Making the Connections, marking World Mental Health Day. My name is Sheehan. I'll be your MC for today's webinar. And we in HSE Health and Wellbeing are delighted to partner with our colleagues in HSE Mental Health today, who are launching their new mental health literacy campaign. Before we begin, we would like to extend our deepest condolences to all those who've been affected by the terrible tragedy in Creasla in County Donegal last Friday. We extend our deepest condolences to those who've lost loved ones, and our thoughts are with the community and all those working in services to support the community at this terrible time. Today is World Mental Health Day. We all have mental health, and today is an opportunity to focus in on our efforts to promote and to improve the population's mental health. Many aspects of our population's mental health have been challenged in recent times with the COVID-19 pandemic and the cost of living crisis. Today, we are focusing in on 4 key themes that our HSE Mental Health Literacy campaign being launched today are focusing on. And those are stress, low mood, anxiety, and sleep. We will be exploring how they are connected and looking at the range of supports that are available to meet the spectrum of mental health needs of our population. I'd now like to call upon IMS to share a poll with us. And this is just to get us thinking about the key themes that we'll be exploring today. So in your own time, if you could answer the question, which of the following do you think people believe impact mental health? Stress, anxiety, low mood, trouble speaking, or all of the above? And we'll be sharing the results with you and exploring them in a little bit more detail during our panel discussion. Thank you for that. I'm now delighted to introduce you to Minister Mary Butler, Minister of State in the Department of Health for Mental Health and Older People. Minister Butler has pre-recorded this short welcome message for us. Thank you.
Hello, today is World Mental Health Day. During our daily lives, many of us will be challenged by our mental health. Some people may suffer emotional distress, anxiety, or depression, and reaching out for help is so important. Other people will suffer from enduring and long-term mental health illness and may need community and long-term supports provided by multidisciplinary teams. My message today is there are many supports and help is available with many national clinical programmes delivered by the HSE, specialising in eating disorders, psychosis, ADHD for adults and children, self-harm and suicide ideation. As many of you will be aware, information about mental health and available supports and services can be found on the HSE website, yourmentalhealth.ie, or by calling the Your Mental Health information line on 1800 111 888. Many people also choose to text 50808, a free anonymous texting from a calming chat to immediate support, anytime, day or night. Text hello to start the conversation. I am fully committed to ensuring the continued improvement of our mental health services. It is also important to remember it is okay not to be okay, and it is okay to ask for help. Take care and look after yourself.
Thank you very much, Minister Butler, and we'll be looking at that range of supports that are available throughout this webinar today. It's now my pleasure to introduce you to Derek Chambers, who's General Manager with HSE National Mental Health Operations. And Derek is going to share with us a short presentation on the new campaign that is launching today. Thank you very much, Derek.
Thanks very much, Aisling. It's a pleasure to be here today and to be part of the Health and Wellbeing webinar on World Mental Health Day and to take the opportunity to launch our new mental health campaign. So I'm just going to share a short presentation with everyone, and at the end of the presentation, we get a chance to view the campaign ad. So, with me 1 second. Okay, so just in terms of the background to the new mental health campaign, it's important to acknowledge that the work actually began in 2019. And then obviously people will be aware of how priorities changed across the country and within the health services in particular around COVID. But the background and the work in developing the campaign did commence back in 2019 through a working group that included ourselves in mental health operations, but also our colleagues in HSE Communications, Health and Wellbeing, and the National Office for Suicide Prevention. And I guess the involvement of our colleagues in HSE Communications is particularly important with the digital developments that have taken place in parallel with the development of the mental health campaign. So that work has been happening in parallel, and today we'll see how those things have come together, the new mental health campaign and our digital developments. So just in terms of that background and briefly, in 2019, we were able to conduct a review of evidence and the best available literature around mental health literacy. So focusing on people's awareness, understanding and knowledge of mental health, both in Ireland and internationally. And through that research, we began to shape our thinking and our campaign development in that mental health literacy space. So this campaign is something that builds on what's gone before in terms of creating awareness and to take a deeper look at some of the key kind of issues and challenges in mental health, and to provide people with information and signposting around mental health difficulties. So following on from that initial phase of research, more recently, we conducted a survey across the country, and we also held some focus groups that zoomed in on mental health literacy and asked some kind of key questions to help us shape the overall campaign. It's important to mention as well that this work has a really strong mandate now. I mean, you know, common sense would tell you that we have a strong mandate to develop mental health resources, but that's reflected in policy as well. So sharing the vision, our national mental health policy, connecting for life, our national suicide prevention plan, and also Stronger Together, the new HSE mental health promotion plan, all require us to develop mental health resources and messaging. So that's part of the context, and it also, I think, encourages that integrated working right across the HSE and with our partners. So the framing of mental health literacy that we are working with has to do with people's awareness and understanding of mental health that enables them to recognize and better understand their own mental health, to know when and how to support others if they need extra support, to identify and respond to difficulties before they worsen, so that people engage with supports at the earliest opportunity, whether that's self-help or social support. And then really importantly as well, to know when it's important to go and visit a service or to engage with a health professional around mental health difficulties that might be more serious and require more in-depth support. So working with that framing of mental health literacy, we conducted that survey across the population and asked people about their own personal experience of mental health difficulties in a direct yes or no question. And 51% of the people who responded said that they did have personal experience of a mental health difficulty. We also wanted to explore common mental health problems like anxiety and depression, and we used short fictional case studies to do that. Stories of people who were experiencing the signs of anxiety or the signs of depression. And I guess the learning from that is reflected in the new content that we've developed on the new web pages on the HSE site. One interesting finding from that was that people seem to have a better understanding of depression compared with anxiety. So, you know, learning like that has been really, really important in shaping the resources that have been developed over the past few months. We also did some qualitative work as well, and I think in the quotes that are included on the slide here, we get a sense of some of the challenges in communicating around mental health, and I suppose those quotes that we have from our respondents really speak to the issues around mental health difficulties like depression and anxiety, and knowing when to get help and to understand those issues better is a real challenge for us. But the most important message in terms of responding to the narrative around mental health is to make sure that there's supports available to everyone depending on their level of need, and making sure that people are aware of the full range of supports that are out there. So we, again, with the campaign in mind and with the website developments in mind, we asked questions about people's understanding of what's good for your mental health, what some of the barriers might be to getting support. And we also went into help seeking in a bit more detail just to see where people would turn. And we did get some interesting results and some interesting findings, knowing that people are open to getting social support, but also I suppose the GP remains a really important source of initial support for mental health difficulties. So that's something that we have to take not into just the campaign alone, but into the implementation of sharing the vision more broadly. And that'll be a key area for us over the next year or two, is to make sure that primary care and mental health services are better integrated, and that we're coordinating supports in a seamless way for the people who need those supports. So that's the background in terms of the planning for the campaign. So I mentioned website developments as well, and it's been really, really important to improve our signposting and to provide information that reflects the needs that were communicated to us by the people that we went out to in our research. So in terms of the website developments, and you can jump onto yourmentalhealth.ie yourself to see the new content, but we've been working on 3 core activities. So one is a new landing page, an enhanced user journey, and new content which reflects the 4 topics that Aisling has already identified, of anxiety, low mood, stress, and trouble sleeping. So that new content is on the site with a really, really strong emphasis on what people can do. So it's not just about explaining the issues, but it's explaining things that you can do for yourself, and also highlighting resources that are available to support somebody, and highlighting the services that are there to help people in dealing with those issues. The second thing that we're currently developing is something similar to the Mind Plan app, which the NHS in England developed and embedded on their Every Mind Matters site. So the Mind Plan app allows people to input some information based on how they're feeling and the type of support that they feel they would use. And in turn, people get personalized support options back to them. So that's something that is in development. There's a lot of work gone into that already. And it'll be a very engaging tool when it is launched. And as I said, it will provide personalized supports based on any one individual's needs at that time. So we're really excited about the development of that. And then more broadly, a big focus for us in this space is to open up the full range of supports that are out there. And I think we've seen over the last couple of years, especially during COVID, how our community and voluntary sector partners have really become really important and essential in the wider mental health landscape. And there's an increased visibility, I think, of our community partners, and there's also an increased visibility and awareness of online and digital supports, right across, from information provision to self-help and person-to-person support. Minister Butler mentioned Text 5808, and that's been just one of a number of fantastic resources that have really become mainstreamed and embedded over the last couple of years. To the campaign then, so through fantastic work from our colleagues in programs and campaigns, work has gone on in terms of developing creative routes, testing those with the public, linking in with all of our stakeholders, so internally within the HSE and in the wider health landscape, and then speaking to the HSE consumer panel. So everything that was done was tested and retested and tweaked, all around the key insights articulated here in terms of the challenges that we have when we're maybe not fitting ourselves or we're stuck being able to recognize that and to recognize what's going on for ourselves, and the tendency at times to maybe dismiss what's going on for ourselves is down to work or other stresses in our lives. You know, it's easy enough to maybe at times think that if we're not sleeping well, if we're not feeling well, if we're feeling a bit anxious or stressed, that it's not connected. But all of these things together, I think, can be connected, and they can be signs that we do need to go and get support. And the earlier we do that, the better. So that's the overall aim of the campaign, is to help people make that connection between common mental health difficulties, and to know when and how to get support, either for themselves or somebody else. And that's all available via yourmentalhealth.ie. So we'll see the ad at the end of my presentation. So this is just a quick preview of the campaign creative. And the dresser, I guess, can represent any one of us. And then the drawers representing stress, anxiety, sleep, low mood, are things that can impact us from time to time. So in terms of where and when, you'll see the campaign. National and local radio is about to launch. We are working with some popular podcasts targeting specific groups within the population, using obviously social and online. So you'll see the ad that will be visible on various video on demand platforms, including YouTube and all four Sky on Demand. And then there'll be a strong outdoor presence as well. So on buses, bus shelters, train stations, and other commuter weight areas. So as I said, you'll see the campaign from today. And the key thing is that people engage with the campaign by going to yourmentalhealth.ie and accessing the information and the other supports and resources that are signposted from there. So thank you. And then I can ask Helena, I think, to show the ad for the campaign.
Not feeling yourself, trouble sleeping, ongoing stress, anxiety, or low mood? They're all part of your mental health. Find support at yourmentalhealth.ie from the HSE.
Thanks very much, Helena. So I am going to hand back to my colleague, Sheehan.
Thank you very much, Derek. It's great to get that overview of the campaign, and I'm sure you will all be supporting us in terms of promoting and amplifying the campaign in the coming weeks. I'm now delighted to introduce the panel to you. We have a great lineup for you of speakers who are going to discuss the themes that have emerged from this mental health campaign, and also some of the supports available and some of the new developments into the future. So I'd like to call on my colleagues now to join me. I'm delighted to be joined by Mark Smith, who's a senior clinical psychologist with the Child and Adolescent Mental Health Services, Claire Gormley, who's Director of Psychology and Primary Care, Karen McHale, who's a peer educator with Mayo Recovery College, Emer Clark, who's Senior Project Manager with HSE Mental Health Operations, and Teresa McElhinney, who's HSE Senior Mental Health Promotion Officer. Thank you so much. Delighted to be joined by you all. I think Derek has given a really good overview there of the campaign, the reasons why we're focusing on those topics. And I suppose something clear that was coming out of the research conducted to inform the development of the campaign, that people don't always connect these four topics and see the connections. Mark, I know you were quite involved in the development of the content for the website. Would you maybe like to say a little bit more about that and how these four themes are connected?
Yes, of course, and thanks for having me here. I think sometimes when we think about our mental health, we think about them as distinct entities, and either I suffer from depression or anxiety or low mood, or I struggle with my sleep, but not always join the dots to see that actually one will impact on another. So if we're feeling a little bit low in ourselves and we're not really motivated to go out and about and interact with others, or we're worried in advance, things like anxious about getting to sleep, that can have a knock-on effect. So what we're trying to do with these conversations is to see to people that lots of maybe smaller issues that impact on our mental health if there's a cumulative impact of those all adding together, can really kind of have a negative impact on us. So we need to see how all of these things interact with each other, and if we can tackle things in smaller, maybe bite-sized portions, it may not feel as overwhelming to try and address some of these issues.
Great, thank you, Mark. Stress is a key theme, and I know something that people really want a lot of information on and support on. Claire, I might come to you next. Could you tell us a little bit about how stress connects with those other areas around anxiety, low mood and sleep? And maybe perhaps some of the techniques that people can use in their everyday lives to alleviate stress?
Yeah, Aisling, I think I'd agree with Mark. I think we can have stress in the background, and then there can be that cumulative effect of it building up significantly, you know. But certainly, you know, if you think of COVID, if we think of what happened during COVID, everybody was stressed by COVID. Nobody's fault, it just came. And then for some people, it would have impacted them on different ways. It could have impacted them by feeling anxious about it. I think most of us were in that group. Some people might have felt very low, very worried about it and so on. And certainly if people, you know, if it was affecting people's sleep, that had a big impact all around. So beyond that, we know that it affected people's behavior, their relationships, you know, and so on. So they're all interconnected. All these issues are interweaving. And when you have a lot of stress on your plate, it's a good sign that you need to actually start to think about what you might do about it. So in terms of what you might do, you might need to pause and think, what are the key things that are actually causing me most stress at the moment? Take stock a little bit and say, okay, what are the things that I can control, the things I can't control, maybe accept there's some things you can't control, and then try to work out a little bit what you need to prioritize. So are there some things that can be broken down and dealt with? And often the common things would be handling how you're thinking about the stress. So you might be thinking, this is awful, I'm not going to be able to manage, whereas possibly if you can change that to, this is going to pass, I'm going to tackle it bit by bit and so on. And very often one of the big things for people is that we criticize ourselves when we're under stress. We're very negative towards ourselves. We blame ourselves. Oh, I'm making a mess of it. I'm not handling it well. So one of the big messages that we would have really would be to everybody to start to be more compassionate with ourselves, to know that anybody would normally find certain experiences very difficult. I'm doing my best, you know, I'm going to work this through. It's not easy, you know, so to be kind to yourself and to be compassionate is really important, you know. I suppose after that, then it involves going for help and supports, you know. So one of the big supports that Derek alluded to in his talk there is the stress control program that's been running and fortunately has gone online. So maybe we might just call for that slide at the moment and just mention that. So stress control has been running for many years, run by the HSE with, you know, town hall meetings and so on. But during COVID, from about April, May 2020, we started to run these online. And to date, 35,000 people have actually attended, which is a fantastic testimony to how valuable people find it and how the word got out there and got around. It's developed by Jim White, and he breaks it into 6 sessions, which are 90 minutes. So it's fairly comprehensive, and the results for the stress control program are really very clear. You know, it can be as effective as one-to-one intervention in certain studies. So it's online, it's accessible under www.stresscontrol.ie. Anyone can access it, and there's a forthcoming program starting on Monday the 17th of October. So each of the sessions is online for a little bit of time, and people can access it and work through the 6 sessions and access materials to support it as well. So that's a wonderful way to help yourself if you're looking, and there are other things people are going to discuss in this discussion, but it's a wonderful way to help yourself to get started.
Thanks a million, Claire. And we do have links on yourmentalhealth.ie. There are links out to those resources, including stress control, if people would like to find out more. We just have a question that's come in the chat, just around feeling disconnected from others and whether that's a sign of potentially mental health difficulties. Would anyone like to say anything on that? Either maybe Claire or Mark or Teresa?
Yeah, sure. I'm happy to just continue. Maybe if somebody else wants to come in. But I think feeling disconnected, it's one of those signs that makes you realize that you probably need to do that, taking stock and feel and just check out what's going on. It's a very common sign. And often when you have a lot of stress happening, you're trying to use your normal coping skills, your normal coping strategies to deal with that and address it. And when that starts to not be sufficient, we can feel overwhelmed, we can want to pull back, we can want to withdraw, we might feel we're not able to do our normal activities and sort of avoid people or whatever. And in actual fact, it's quite the opposite of that we need to do. That's when we need to talk to a friend, talk to a family member, check out a discussion with your GP, look for resources. But feeling disconnected is probably a very good sign that maybe you've tried as much as you can, and maybe you need to get somebody to come in and get on your team and give you a hand out at that stage.
Thank you, Claire. Teresa, I'll come to you next. And I suppose another key resource in HSE support that's available is the Minding Your Wellbeing programme. Could you maybe tell us a little bit about that resource and what it entails?
Sure, Aisling, thank you. This program, like Stress Control, is an online video program, and it's made up of 5 individual sessions. And if we could show the first slide there, just to that lays out the themes of the program. We're looking at self-care, and when with this new campaign, one of the messages is around the importance of sleep or how that impacts our mental health. And that will be one of the key messages of the self-care session, of the need to get good quality sleep and how that can impact our mental health and well-being. The other would be around our thoughts, and this would be tied into stress and anxiety. The way we think contributes to our anxiety, and if we can change the way we think or notice the way we think, it can help reduce our stress and reduce our anxiety in a lot of situations. Again, in the new campaign, we talk about mood and the importance of mood. So within Minding Your Wellbeing, we look at exploring our emotions and how we can notice when our mood is low and what we can do to try and boost it. Claire was talking there about the impact of connection and how when we are stressed or feeling low that we can withdraw sometimes or feel disconnected. So quality relationships is probably one of the greatest contributors to positive mental health. So one of the sessions there looks at how we can build positive relationships and really nourish the relationships that we have, and look at how we can make connections, even small connections every day. Even having a chat at the bus stop or in your local shop does boost your mood. And overall then just looking at how we can boost our resilience, because our mental well-being is affected by so many different things. So it's really about trying to build our strengths and build our resilience to improve our mental health and well-being. And all of these, a bit like the new campaign, they all tie together. And one of the key themes going through all of them, all of the sessions, would be about noticing. And Claire mentioned the benefit of pausing and tuning in. So that would be a theme of the whole program, would be the need to slow down, just take a pause. How am I feeling? What do I need? What can I do for myself? And the program gives a lot of hints and tips about what you can do for yourself. And if you'd like to show the second slide, there is a little resource to go with the program. You can order this from yourmentalhealth.ie, and it just helps you assess things like your emotions or what your self-care is like and how you can maybe improve your self-care so you can reflect on your own well-being, and the booklet does help you to do that. So as I said, you can order that from yourmentalhealth.ie.
Brilliant. Thanks a million, Teresa. So we'd encourage, for anyone who isn't familiar with those resources, we'd encourage you to have a look, and you may be interested in taking part yourself or promoting it with others. Thanks a million, Teresa. Emer, I might come to you next. And I suppose a lot of people will have been very familiar with the previous mental health campaign, The Little Things. Can you tell us a little bit about how this campaign differs?
Absolutely. When I joined the HSE 6 years ago, that was the first job I had, was to roll out the Little Things campaign, and it was a lovely campaign. But the main difference really for this one is that campaign would have been signposting to things that people could do for themselves, and it was really practical, good advice around eating well, sleeping well, talking to others. Whereas we've gone a step up really on this one, and it's pulling together all of the existing resources and the resources that were being developed over the last number of years, pulling them together and putting them into packaging them up really, and letting people know that you don't just have to do all of this on your own. There is something there on the website for you at various levels. And I know Mark and Claire were talking about the different things that will meet the needs at that particular point. But whether it's the text 50808 if you're in a particular crisis point at that stage, or that the stress control program might be something that you'd like to get involved in and do it over a number of weeks and months. But really there's something there for everyone, and whether it's online counselling or online CBT. So we've been developing those initiatives over time and now packaging them together and putting them onto the website. So it's just a build on the Little Things campaign. The Little Things campaign, the advice is still valid. There's a lot out there. And I noticed a question in the chat as well. Somebody was asking about campaigns for younger people as well. And while this is targeted at a population of 18 plus, it's certainly not exclusive to younger people. And Mark actually would have worked with us on a campaign very specifically for younger people a few years ago around mind monsters. So we are very conscious of that age group, and we would be targeting them through our media strategy. And they would, through the policies that Derek referenced, Connecting for Life, priority groups, young people are definitely one of those, Sharing the Vision, there's a youth mental health transitions group there. So they will always be a group that we will be looking to. For now, we just really needed to get a population-wide campaign up and running, and for it to fit within those policies that Derek referenced earlier.
Thanks very much, Emer. And I know a few people in the Q&A as well are interested in the campaign material and resources and to help promote those. So that's something we can make available to people in the post-webinar communication.
There'll be partner packs going out today. My colleagues in communications, they've taken on, I no longer work on the communications side, so I won't take the credit for this particular campaign. They've done all of that work, and partner packs will be shared with all of our stakeholders, internal and external.
Fantastic, thank you. Karen, I'd like to ask you, I suppose we've been talking about some of the supports that are available. Could you tell us a little bit about what's available through recovery colleges, and tell us maybe a little bit about your work in that area?
Absolutely, thanks Aisling. So recovery education is for everyone with an interest in mental health and well-being. So I'm based in Mayo, but there are 13 recovery colleges or recovery education hubs nationally. So we deliver, like Claire and Teresa were speaking about, the online. We deliver online and face-to-face, and we also deliver some outreach sessions to different towns as well as around the country. So I know you're going putting it in the chat there around the resources. Please do get in touch. As I said, the website is there. So just, I suppose, building on what the ladies were speaking about, the theme of today being that connection piece, so important. And a lot of the work that we do in collaboration with the Mental Health Engagement and Recovery Office, HSE, Mental Health Ireland, is around that connection piece. And a lot of our work is underpinned by CHIME. So C being connection, H being hope, I being identity, M being meaning, and E being empowerment. And how can we bring all of them pieces together? And as I said, the connection, hope being really, really important. And for anyone that's out there today that may not have somebody to speak to, there are lots of supports available. You're never on your own. The hope piece, how can you inspire hope? Identity, if you do have a mental health challenge, or if you do have a diagnosis, your diagnosis doesn't have to define you. You're more than that. There's other pieces, meaning. What sparks meaning for you? What creates meaning? For some people, it's just getting up, making the bed, having some healthy food, like Emer alluded to there earlier on. And the empowerment piece, what can I do for myself today? What are the supports? Who can I reach out and talk to? So none of us are on our own. yeah, and I'd invite anyone to get in touch with any of the services today. Thanks, Ashley.
Thank you, Karen. I suppose one of the key features of the campaign is trying to help people to navigate, I suppose, when they might need more support. And there's obviously various levels of support available. Mark, could you perhaps say a little bit about that, and I suppose how do people know when they need more than something like using a stress control or minding your wellbeing program and might need more support? How can people find that out?
I think one of the things that we need to do is some of the panelists mentioned earlier on about kind of noticing how we're thinking and noticing how we're feeling. And we're living in a very fast-paced world and fast-paced society where we've a lot of things on. We're all really busy, and we don't often stop and take time to think and reflect on how we're doing. And if we do, we don't always maybe necessarily pay the most attention to it. So I think it is about giving ourselves that permission to be able to actually think about, well, how am I feeling, and how am I noticing it in my body and what's in my thoughts. But I think one of maybe the key things is just maybe two key things. One is that if the difficulties that we're struggling with, if our mood is low or if we're kind of feeling quite anxious, if it's lasting longer than we expect it to be, so it's there more times than not, and we're not getting any respite from it, it's maybe time to pay attention to that. The other piece maybe is connected to one of those questions around that feeling disconnected. If whatever we're struggling with, be that our sleep or our anxiety or our mood, is getting in the way of everyday things that we'd like to otherwise be able to do. So stopping us from going out with our friends, or from going for that walk, or from maybe talking to somebody, because we're just feeling so anxious about it, then we need to pay attention to it. So I think the two things is the longevity. If it's going on longer than we normally would experience it, and we're not getting a respite from it, and if it's getting in the way of everyday things that we'd otherwise be able to do, then we should be looking to maybe get some more help on it.
Great, thank you, Mark. Claire, would you like to add anything to that? Oh, you're just on mute, Claire.
Yeah, I think when things are going on for a long time, and as I said earlier, and Mark has reiterated, you know, when you've tried your best with the coping strategies that you have access to, then it's definitely time to be looking for some support. And I think also sometimes another signal could be if you're feeling, you know, that you can't shake it off, and you've come to the point where maybe you feel, well, life isn't really worth living, or, you know, maybe people would feel they'd be, you know, they're better off without me. If you're starting to think, you know, that those sort of darker and more difficult thoughts, then that's definitely a sign that you want to step up, move to your GP, or if you're with a mental health service or whatever, speak to your therapist or counsellor and share those thoughts. A lot of people have had very dark and difficult thoughts, and yet, you know, with support, you know, no man is an island. And when you share that, you know, like the Little Things campaign said, share. When you share something with others, you start to put it into perspective a little bit more again, and get that support, get that lift that you need to carry on. So I think it's when you feel you're not coping and you get that sense yourself, or when other people around you, your family and friends, suggest to you, if you ask them for feedback, they might suggest to you that they think you're not yourself, you're not coping, and maybe it'd be helpful to do something. And it's listening to those bits of information that come into you, and listening to yourself is important for making that decision, and not to be afraid to do it. I mean, I worked 40 years ago, actually, in the 80s, I was working on research on the stigma of mental illness in Ireland. And there was no literature. I really struggled to do a literature search because there was no literature, and one or two books maybe. But and now look at the openness. People understand. We all can struggle at times, and we can all support each other to get through it as well. So those are important things to remember too.
If I could just add to one point, as Claire made there, to add to it, about we have this instinct in Ireland when friends or family would ask us if we're okay, to automatically say, I'm grand. And we don't think it, we just say it because it's the instinctive thing to say. But sometimes it's important for us to actually resist that urge to say I'm grand, and to pay attention to the friends and family. What is it that they've noticed? And maybe I'm not okay. Because it's really hard to be objective with ourselves and our thoughts and our feelings. And the more sources of information we can to reflect on how we're doing can really help us get a more rounded picture of whether we are struggling or not.
Thank you, Mark. Emer, I know.
And I think,
oh, sorry, Teresa, go ahead.
I was just going to come in there, Aisling, and just say that the fact this year that we've launched Stronger Together, the first national mental health promotion plan, it's so timely because people are coming out of a very dark and tough period. And one of the goals of that would be to really enhance public awareness of the need to promote positive mental health and to reduce the stigma, and how we can do that. So this campaign really does tie into one of the goals there around enhancing public awareness. And it does take a life course approach. So it's looking at that there's different ways that we need to maybe look after our mental health and well-being at different stages in our lives. So the goals and the actions in the plan would reflect that. So as we get older, then we may need to look after our mental health in a different way. So it's really just being aware of that. And the new plan, I suppose, supports that it provides a framework for the HSE to look at how we do need to target mental health at the different stages of life.
Thank you, Teresa. And just on the topic of stigma, Karen, I know this is work that in recovery colleges that you look at a lot. Could you share maybe some of the learning, some of your experiences around trying to tackle stigma in this area?
Absolutely. Yeah, and it's one of the key things. And I suppose even ourselves, where we're based in Mayo, we're in the old St. Mary's Hospital. So that, I suppose, in itself, first, the fact that we are providing recovery education in, you know, a place that used to be the old psychiatric hospital, you know, may have shown how stigma is, you know, we're talking about it. That's the thing. We're talking about it. One of the key factors as well that we, in recovery education, when we're co-designing or co-producing any of our modules, we bring in representation from people who have lived their own lived experience of challenges, family members, and also staff who work in the services. So we're co-producing and co-designing bodies of work together, and that in itself is breaking down stigma. That in itself is having conversations, you know, around our mental health. We all have it, you know, as we spoke about earlier on. And now it's, you know, how do we look after it? How do we maintain it? How do we talk about it when things aren't great? You know, name it to tame it. So it's a constant work in progress, Aisling, but we have had, you know, significant progression over the last 10 years or so. So it's, you know, peer support, lots of different things that are different now. Yeah. Thanks, Aisling.
Emer, I know some changes have been made to the website, yourmentalhealth.ie, to enable people to navigate that a little bit easier in terms of the level of supports needed. Can you maybe say about what changes have been made?
Absolutely. Our colleagues in HSE Digital, I think there's something like 150 user changes have been made to it. You wouldn't see them to the naked eye, but definitely in the background, there's lots of things going on there just to make the content a bit more available and for people that are searching for content. So around the new campaign, there's already some new content around those 4 topics, and that's been added to the landing page now, and people can access that immediately. But really, all of that content is grounded in the options for self-help, and really just to get people to read the content and then see what's available. So previously, you know, we would have been just telling people to, again, like Mark was saying, you go out and do all these great things that you can do for yourself. Whereas now they can see the resources that are available embedded within that content and get the options of like, this will work for me within that particular scenario. So that's really one of the changes that's been made to the website. And the other that we're not finished. So we, as Derek alluded to, the fact that we have the mind plan in development as well. And we hope to have that launched in the next couple of months. And really that will be another part of the self-help journey for people, that they can sign up and they can take learnings from that and have that as being something that's a bit more ongoing. And what Karen was saying there as well about the peer support, again, it's so wonderful. We've seen the research to show that really works. And Derek has literally just left now to go and join another webinar today, because the HSE is launching online peer support with the HEA for 3rd level students as well. So we can see that all of those digital supports that are so important, and we're just our focus is to try and pull them all together so that recovery will be embedded back into your mentalhealth.ie as well. So we would be working closely with mental health engagement and recovery on that. We'll be adding in links to how people can access the online peer support, and there's lots of great things happening, as you'd be aware, from Sharing the Vision and the digital specialist group that we have there, lining in with Domain 1 from that policy. So our work is far from over, but and the developments will probably never be done, but at the moment we're really pleased, and our colleagues have told us that anyone searching for that content should actually find it a lot easier now.
Thank you, Emer. Great to hear about the new developments that are coming later down the line as well. Claire, another development that's coming later down the line is the HSE's new stress management programme. Could you tell us about that programme and when people might be able to expect it?
Yeah, absolutely. No, thanks for that, Aisling. We're developing. We're in the tail end, if you like, of developing a new program. It will be 6 sessions, about 90 minutes long, but we're because of COVID, as we started to develop it a while back, because of COVID, it's going to be online initially. Then hopefully it will move out to something similar to stress control, where you can, provide it face to face in groups and larger venues and things like that. But I suppose what we've looked at very much is there's a lot of brilliant information out there on stress management and so on. And a lot of people have become familiar with the basic information on stress management, and maybe you're looking for a little more. So I suppose it's the themes that I was mentioning earlier of, we're using compassion-focused approaches, we're using positive psychology and combining that with the cognitive behavioral therapies as well as lifestyle management. So trying to package something with a kind of cornerstone message that, it's very normal to be stressed. We can all struggle with it when it mounts up too much, and yet to be compassionate to yourself is taking away an element that often adds on. Stress is often increased by that add-on of being negative or judgmental to yourself. If you can take that away, and then in the positive psychology, look at your strengths, look at what's going well for you, focus on some positive experiences and so on as well. So I think we're trying to just bring a fresh combination of ideas to support people to be able to move into the stress management without feeling bad about themselves, to feel more soothed and calm in doing that. And hopefully that will bring more confidence and more ability to take on board and make the changes that they might need to make. So we're excited about that.
Brilliant. Thank you, Claire. I'm looking forward to seeing that, hopefully early next year, and that'll be available. Teresa, there's a specific question in the chat here, just around, you raised that idea of looking after your mental health in different ways as you get older. And Liz Nolan here is interested in that issue of later life and loneliness, and whether you have any research or comment on what works well, or what's the biggest barrier to tackling this in our loved ones in later life. If you have any thoughts for us on that.
I think when we were looking at My New Wellbeing, we had hoped to maybe adapt it for older people, and we did some consultation. And one of the points that came back from older people themselves was that sometimes we view older people as a homogenous group with the same needs. So what we, which obviously is not true. And what the challenge is to try and say, for instance, for older people, is to provide supports that are different depending on the situation they're in. Some older people are living quite independently at home, but may feel isolated. Some people could be in residential care. Some people could be living with their families. So it's trying to find a way of reaching them with different approaches that would suit. We do know, I suppose, as people get older, they may become more lonely, they may lose friends, or they have moved maybe into nursing homes. So it's really looking at how do we find a way that reaches people in their different environments, and that is a challenge. And I know some of the NGOs were doing some research around loneliness in older age and what would reduce that and what would have the greatest impact. So we are trying to look at how within the Mind New Wellbeing programme, how we can make it accessible for a wider range of older people, but that's a work in progress at the minute. But we hope as soon as we have something, real and tangible, that we can make it available.
Thanks a million, Teresa. There's another interesting comment just in here. I might put this to you, Mark, which is, I suppose, around something we struggle with. I think the terminology and the language around mental health. And I know when we were developing the HSE mental health promotion plan, it's a challenge, because I think when people hear mental health, they think of mental illness. And I suppose that there's a question put to us, do we need to start talking different language to distinguish them? Or is it more around kind of promoting what we mean by mental health, and it's not just the absence of ill mental health, that it's seen as a positive resource? Do you have any thoughts on how we get around some of those challenges around language?
Yeah, I saw that question. I think it's a very fair comment. I think we've moved to a position of seeing kind of mental health as being on a continuum, and that you can go from things that maybe short-term impact on your mental health to really serious impacts that are severe and enduring. And I think one of the things, and probably part of this campaign will achieve, is about improving communication and education about that, about noticing what is maybe a short-term impact on mental health versus something that's more prolonged and enduring. But I think to acknowledge and validate, there is a confusion out there too about knowing the difference between when you might go to perhaps primary care psychology services for support with your mental health versus going to adult mental health services, and how do I know the difference? So I think we still have work to do on helping to educate on those pathways. And it's not just about the help-seeking behaviour in the beginning. It's also about supporting our kind of partners, our GPs, our referrers, about where are the appropriate pathways. Because we talk a lot about no wrong door, but I suppose we need to be able to point people towards which is the right door to go to in the first place. And how do I know? And I think that is that education piece about helping people to notice more about their mental health. But I think that the key piece is also validating people. Is to say, when you're feeling really anxious about something, that we're not trying to stop that maybe it's the right thing to feel. If you're feeling sad, if you're feeling lonely because you're disconnected, that is the appropriate feeling that you're supposed to feel in that situation. And it's how we help you cope with that. And it's not always going to be about going to a specialist mental health service. Sometimes it's about friends and family, and our colleagues in Jigsaw have always had this campaign of one good adult. And it's about using that full resources to educate people, and also to show that mental health is a continuum. And we can talk about it without meaning that it's severe, but to do that, people need to understand better about what they feel, but also what resources should match that level of feeling or impairment that they might be struggling with.
Mm-hmm, mm-hmm. Thank you, Mark. Anybody else have any thoughts they'd like to come in with on that topic? No, it's a challenging one just around the language, and I suppose it comes back to that topic of stigma that we talked about earlier. And I think we're drawing to the close of the panel discussion, and I think just for the last few minutes, I suppose we've mentioned the policy context for a lot of this work, sharing the vision, connecting for life, the HSE mental health promotion plan, and I suppose just to conclude, maybe to say a little bit about what's coming down the tracks in terms of how those policies are being implemented. I know there was some, as Teresa, you were speaking around supports for older people. There was some questions around what's going to be available into the future. I know that there was a particular question around as well, which is a recommendation sharing the vision on what making sure the public are aware of the full range of supports that are available, not just HSE funded supports, but the full wide range of supports available through the community and voluntary sector as well. So I know there's lots of work happening to progress those different policies. I might come to you first, Emer. Would you like to say a little bit about some of the future plans for how this work evolves?
Sure. Well, I suppose sharing the vision is probably the newest policy that has been launched. It was launched in 2020, but this year then the implementation plan is really what's coming out of that policy, and that's the main difference for sharing the vision versus Vision for Change. There's an actual implementation plan there with 100 recommendations. So that the work within that that policy has now been divided up into 10 work streams, and they're all taking a focus on the different recommendations. And as I mentioned, mental health promotion, digital mental health, youth mental health transitions that Mark is very close to as well. So all of those recommendations have been grouped together to create proper streams of work that will actually hopefully affect change in those particular areas. And we're tracking them, and we have the National Implementation Monitoring Committee as well that the HSE meet with regularly to show the progress and the updates on all of that work. So as well as sharing the vision and that work that's happening, a mapping exercise against Connecting for Life was already conducted well in advance of us starting anything new, to make sure that we weren't duplicating any work, because resources are tight wherever you go. So looking at, and a lot of the people are same people looking at the different things, and again mapping against the mental health promotion plan. So we're very much in touch with all of those different groups to make sure that what's happening and sharing the vision might actually be achieving some of the actions and recommendations within the mental health promotion plan, so that work is then transferred over and people can say, okay, right, we won't create that. And same with Connecting for Life, huge amount of learnings on the implementation of Connecting for Life that made it so much easier for us then to get sharing the vision up and running, and to start those work streams, and to maybe take a little bit of a more targeted direction in trying to get the actions and recommendations off the ground. Sorry, that sounds like an awful lot of policy speak in one go.
That's great. That's great, Emer. And if I might just briefly say, just around the HSE mental health promotion plan, we've just we published it last April, and we've just set up our steering group now, and we're progressing all of those actions. One of the actions under there, something that we didn't really get a chance to talk about, but is supports, I think, for HSE staff, in particular health service staff, how you can promote positive mental health in your everyday interactions with patients and service users. So we do have a new module as part of the Making Every Contact Count programme. Teresa, I know you were involved in the development of it. Do you want to very briefly maybe just say a little
Sure,
bit about
Aisling, I meant to say that earlier on. Yes, within the Making Every Contact Count, there are two new modules. One is around working with obesity and weight management, and the other is around promoting positive mental health. And it really is to encourage HSE practitioners to inquire about mental health and well-being in their everyday consultations, just to open that conversation, because by doing that, it gives people permission to talk about their mental health. In that way, it helps reduce stigma, but it also allows the practitioner to signpost then to further supports. So the Making Every Contact module is on HSE land. The mental health module is on HSE land as part of the Making Every Contact Count programme. So I think it just went live there about a month ago.
Brilliant, thank you. And just to very briefly plug another new module, which is around promoting positive mental health with migrants, and that's now available on HSE land as well, and a piece of work that we conducted with our colleagues in HSE Social Inclusion. So for anyone working with migrants, that's a really useful resource that we'd encourage you to have a look at. I'm going to ask everyone to maybe part with a closing comment. Before we do that, we're just going to share the results of our poll that we did earlier. Just interested to see the results of that. Okay, very interesting. So as you can see, most people choosing all of the above, 89%. And as we know, as we have been discussing, all of these impact on our mental health. But I think some of the research that Derek shared showed that maybe not everyone realises or notices this. So very interesting. I'll just go around just for a quick comment from everyone, just any closing remarks that you'd like to leave people with. Karen, I might start with you.
Great, thanks, Aisling. Yeah, fantastic to be here today. I think just to, reiterate that there's some fantastic work, being done around the country. And for anyone that wants to, reach out today, please do so. Please do so. Thanks.
Brilliant. Thank you, Karen. Mark?
Yeah, I think one of the things I've noticed over the years is that people are great at reaching out to others and offering help and offering support. But one thing I think that everyone can improve on is giving themselves permission to actually look after themselves first. Because if you're naturally a carer, you're naturally kind and want to help others, to do that, you can't empty your own well. You have to kind of go back and look after yourself and give yourself permission to do that.
Thank you, Mark. Claire?
Very much the same. I think, I suppose, look how far we've come, you know, look at all the resources, the fabulous resources that are available today, the Recovery College, you know, minding your well-being, stress control, all of the different developments and the policies that are happening. People are really interested in supporting people, and whether you call it your mental health or whether you call it your psychological well-being or just being in good form, it is much less relevant than knowing that we are all in this boat together. We all can be stressed. It's very normal, and all the stuff that happens to you in your life impacts on you. So in different ways, it's about stepping up and thinking, it's okay to ask for some support. It's okay to do something about this, and maybe a good time is now.
Brilliant. Thank you, Claire. Teresa?
I think it's coming back to one of the older campaigns, the little things, that sometimes it's the small changes that make a difference for us, that sometimes we wait until all the ducks are in a row to make huge changes, and that day might never come. So it is about just making small changes in everyday life to make yourself feel better, or to make others feel better as well. And being kind to yourself and being kind to others is a really great start.
Thank you, Teresa. And finally, Emer?
I suppose just if there was only one piece of information I'd love people to remember at the end of the day is to really just have a quick look at your mentalhealth.ie, even if you don't feel you might need any information on supports and services. As Mark's saying, like and Claire said, don't wait until you do. Find out now, just have a quick look, scan and see what those phone supports, the online stuff that's available, and all of the other wonderful resources, and just be aware of them. And then when you need them, you won't have to waste time looking for them.
Thank you so much. And just, if I may, just one other service that we didn't get a chance to delve into, but social prescribing is another service. And we now have over 31 HSE funded social prescribing services across the country for all walks of life, across all life stages, and a number of new sites scaled up as part of our Sláintecare Healthy Community Service. So as Claire said, we have come a long way in terms of the supports that are available, but lots more, lots more to do. And I think our 3 policy documents help to shape that way forward and set that path forward. So I'd just like to say a huge thank you to all our speakers. That was really, really fascinating discussion. And thank you earlier to Derek as well for presenting on the campaign. We really hope, as Emer said, that you can all visit yourmentalhealth.ie, have a look at the new developments to the site, let us know what you think. We will be sending around a post-webinar material, and as Emer said as well, a partner pack will be going out for our partners to help promote and amplify the campaign. So I'd like to say a huge thank you to you all for being here today. Really appreciate your support with the work on the campaign. And I'd like to thank everybody behind the scenes working on the campaign and to make today's webinar happen. Thank you all very much. I'd now like to call on the radio ad to be played to finish us off. Thank you very much, everybody.
So you're saying mental health difficulties can be smaller things?
Yeah.
Like trouble sleeping?
Yeah.
Or if I'm always stressed, like?
Yeah.
Or often anxious?
They're all part of your mental health.
Thought those were separate.
Nope. They're all connected.
Hey, how do you know all this anyway?
Ah, sure, I've been there myself.
Anxiety, ongoing stress, low mood or trouble sleeping, they're all part of your mental health. Make the connection and find support that can help at yourmentalhealth.ie from the HSE.
An éon rud atá rágad nó do bhéadfadh rudaí beaga chur asca do bhearláinte.
Is é?
Deacrachtaí cuddalta.
Se.
nó má bhíonn faoi bhrú a gcónaí.
Se.
nó imníoch go minic.
Tá buinte acu ilig le do bhearláinte.
Cén dóí a bhfuil is agat é seo ilig?
Ah, brat níam im a dhé féin faoi mar is oldit.
Imní, brúseasta, ís le brí, gan a bheithan an colour, buineann siad seo ileag le do bhearlánta. Déan an ceangal agus bhaidhcúnamh ag yourmentalhealth.ie. Ó aimimeach na seirbhíse sláinte.